A local mother was rushing her sick daughter to Wolfson Children's Hospital when she says she was left stranded by the train in San Marco for 27 minutes.
If it were something more emergent, she would be dead.
It's a problem News4JAX I-team has been looking into.
And it's one the city of Jacksonville and other stakeholders have been working to address, but relief may still be years away. I-team reporter Ann Maxwell joining us live. She spoke with that mom today. Ann?
Ken, this mom says she's had thoughts a lot of us have probably had over the years. What happens if somebody's trying to get to one of these hospitals in San Marco during an emergency? Last week, she says that fear came true as her infant daughter was choking for air in the back seat. The San Marco train can slow you down. But when the train blocks your path to the hospital,
And all I could do, I cried and I prayed.
it can make an emergency situation even worse. Ray Osteen says she rushed her 19-month-old daughter to the hospital from Jacksonville Beach Thursday morning, only to be left trapped in standstill traffic on the off-ramp from I-95 to Mary Street, just around the corner from Wolfson Children's Hospital.
It was a one lane with concrete walls. I couldn't.
Meanwhile, her toddler was in the back seat, panting, wheezing, struggling to breathe. You can see the train crawling by in a video recorded by Osteen.
Train is going a snail's pace. I've been stuck on the off-ramp for 25 minutes to get to the hospital with my sick baby. I kept thinking, it's bound to pass soon, it's bound to end soon, but as time went on, I finally called my husband back and said, my hands are tied.
After 27 minutes, she arrived at the hospital where her baby stayed the night with what was either asthma or a lung infection. Wolfson Children's Hospital is just one part of the Baptist Health Complex that faces roadblocks from trains.
This is absurd that trains are allowed to go through downtown Jacksonville at a snail's pace when there's hospitals scattered around the road.
Jacksonville City Councilwoman Leanna Cumber, who represents the San Marco area and is running for mayor, says the city is working with the railroads and other partners to address the issue.
There is a solution. There's a fully funded solution that I spearheaded several years ago.
She says a $35 million project is underway to add new tracks at a rail yard to prevent backups that leave trains sitting on the tracks in San Marco, with the money coming from several different agencies, including about $900,000 from the city. Why can't the railroad tracks be moved?
So there are freight lines that need to go from one place to another to get our goods there. These lines have been here this was Henry Flagler's railroad, so these lines have been here for well over 100 years.
She says there's no limit on the lengths of trains either, and local governments don't have the authority to regulate railroads. That's up to the federal government. As for Osteen, her prayer now is that others aren't kept from life-saving care because of a train.
It's just not okay. Not when there's kids and anybody with health and lives on the table.
Councilwoman Cumber estimates that construction project of those extra rail lines is set to be done maybe in 2024. And again, that wouldn't stop trains coming through San Marco here, but she says it would keep them from just sitting on the tracks. We also reached out to the Florida East Coast Railroad, which owns this track, but we haven't yet heard back. Live in San Marco, Ann Maxwell, Channel 4, the local station.
And those of us who work or live in this area, we've encountered that train. What is Baptist Health saying about this situation? This isn't the first time that somebody has probably brought this to their attention.
Kent, they say it's crucial that they have more access points to their hospitals here in San Marco. They say they're also working with the city and those other stakeholders on that solution Councilwoman Cumber was speaking with us about.
All right, Ann Maxwell reporting live for us tonight. Thank you, Ann.